We have had much to celebrate people who are community activists, people at the Center for Community Change, people at the Gamaliel Foundation. Much to celebrate, but now there comes a time when the expectations have to be satisfied if we are to go forward. Now comes a time for understanding how it is that we came to this moment, as well as how to be effective in terms of achieving real change. And that's what we're going to do today in the roundtable. We're going to have two roundtables, the first focusing on this moment, where we are and who we are as an American family, especially in regards to the economic crisis. And then we're going to talk about making the most of the next year, being effective in terms of getting grassroots voices heard in the national, local level. That's the key, and we're going to do it right here, right now. Let me ask the first panel to join me. We're joined here by Larry Mishel, who's the president of the Economic Policy Institute. Larry, thanks for coming today. Let me begin with you, Larry, and ask a very specific question about the economic crisis that everybody in this audience knows so well. When it comes to understanding from an economist's point of view, and you're an economist, how we got to this moment in terms of unemployment, poverty, income, how would you describe it?
Well, I think what everyone knows is that families have been struggling for a really long time, and that they really have felt they'd been in a recession way before we actually got into the recession. And the reason is that in the Bush years, it was the first time in the post-war period where incomes didn't grow for working families at all, which is because there was not vigorous employment growth in hours, the hourly wages and benefits of people, whether you were a high school graduate or a college graduate, did not grow at all in the recovery. So they ended up losing $2,000 apiece. And that was before we got to the recession that started last year, where now we've got unemployment up from, 3 million more people unemployed, 3 million more people working part-time that want a full-time job, et cetera. So, we haven't been doing well, and now we're in the soup.
All right. Let's make sure that everybody can hear. Can you hear me? No? We're going to have to ask the sound people to turn it up a little bit. Bear with us as we try to get that fixed for you. Arlene Holt-Baker is Executive Vice President for the AFL-CIO. And Arlene, hearing what Larry's saying about the economic conditions, I wanted to ask you about bringing voices to the table. You've done it working in the union movement. What happened there? How are those voices heard? How have they been heard?
Well, I'll tell you, Larry addressed it very well. What we know is that this economy has not been working for working families for an awful long time. And let me just share with you what we hear when we're out there and we're talking to people in so many of our communities. And what we're hearing from them is we can't afford health care. We don't have access to it. And even if we had access to it, it's not affordable. People do not have jobs in our families, and we need jobs. America needs a job right now. Too many Americans are suffering. And you listen to the mothers and fathers whose aspiration is to send their children to college, but they know with the stagnant incomes that they have and the low-wage jobs that they're working, they're not able to do so. So many millions in America right now are depending on something really changing so that they can realize America's promise. We have a lot of work to do, but we've got to put America back to work, and we've got to make sure that the 47 million in our country who don't have health care have it.
We're also joined this afternoon by Jay Johnson, who's the chairwoman of the Virginia Organizing Project, her 5th year there. Jay, tell me Tell me a little bit about families. Tell me a little bit about families dealing with health care. What we've just heard is these are difficult economic times. But on the grassroots level, what have you been seeing as you're trying to help people deal with health care problems, just to pick one specific area where families are being impacted?
Well, thank you, Juan. What I can tell you is that American families are drowning in debt. Fixing health care is central to fixing this economy. Employers are not able to provide the kind of what we call really good health insurance anymore. Employees are trying to hold on with everything they've got, but they're ending up paying for less benefits, less coverage, more deductibles, and higher premiums. Something has to be done about that. Meanwhile, health insurance is tied into having a job. So we've got millions of people who are uninsured, and they are left with few resources to try to negotiate with health insurance, gigantic health insurance companies. And even with all these limited options, we know one thing is for sure, that every family in America has fewer and fewer dollars in their pockets. The more health insurance they have, the fewer dollars that they have. Even people across different income levels are afraid to get sick. And more people are not even getting preventive care. There are inequities in the system. People of color, working poor, immigrants, people who are in rural areas have a difficult time getting access to any health care. Every day, more and more families in America are facing a mountain of debt.
And that's what you're seeing in Virginia.
Absolutely.
Now, we're really lucky here today to have two tremendous members of the U.S. Congress with us, John Sarbanes of Maryland and Luis Gutierrez of Illinois. Congressman Sarbanes, let me ask you about just what we've been discussing with our fellow panelists. American families, trying to understand how we got to this moment of financial crisis when so many people feel a crunch, when people in this audience are trying their best to help those in need. What do you see from Capitol Hill in terms of American families?
Well, I think it's the way we approach public policy. It's no wonder that our country is in the situation it is, because for 8 years at least, in terms of what we've had in the White House, we've had somebody who got up every morning and he was thinking very creatively, what can I do today to help people who don't need any help? Instead of... And when that's how you start your day as an elected official or a policymaker, at the end of the day, you're going to make bad public policy. If you get up in the morning, as I think our new president will, thinking, what can I do today to help people who are hurting, to help working people, to help working families, you may not get it right all the time, but you'll make good, sound public policy most of the time. And what I ask all of you to do is to challenge your elected officials and assess them on that basis. Are they people who get up every day thinking, what can we do today to put America back to work? If those are the folks that are in Washington and at the state level, we're going to get good results.
Congressman Sarbanes, thank you very much.